We interrupt this program for breaking news from the Global National Newsroom.
Hello, thanks for joining us on TV and on our online platforms. I'm Robin Gill. We're waiting for Prime Minister Justin Trudeau to address Canadians. But let's give you some of the big picture numbers. More than 1,400 people in Canada have died of COVID-19, and the number of confirmed cases has now surpassed 33,000. Today, Ontario is reporting 568 new COVID-19 cases. 39 more people have died. In total now, in Ontario, more than 10,000 people have tested positive. We're expecting updates from the other provinces in the next few hours. But there's another developing story we're watching in Nova Scotia. Police there had been warning of an active shooter in the rural community of Portapique. He's been identified as 51-year-old Gabriel Wortman, and police say he is now in custody. We know there are multiple victims, but police haven't said how many people were wounded or if anyone was killed. We will continue to watch that development. We're also watching to see if the Prime Minister has any comments on that situation. But first, let's bring in Global's Heather Yerkes-West in Calgary. Heather, there's growing concern about an outbreak at an oil sands camp in Alberta. What are you hearing about testing, isolation, anything along those lines?
Yeah, Robin, this is a major concern given the amount of people that are working in this Northern Alberta oil sands camp and how many of them are flying in and out, traveling to not only other parts of Alberta, but other parts of the country. Now, our last official update from the company came Friday. They told us then that there were 12 cases, 2 on site and 10 others off site. Now, since then, we've accessed employee memos to employees and the messaging coming from the company now is that there are additional cases, as many as 4 cases on site and several more in the community, bringing a total to 18 cases now. The company is telling its employees that this week there will be testing available on site, that they hope to have testing available on site for employees, that testing will be voluntary but available to all workers, even if they are from out of province. We've also heard direction now from health authorities outside of Alberta, Saskatchewan Health Authority, the Northern Intertribal Health Authority, and the BC Interior Health Region have all directed workers that are returning from Northern Alberta and specifically from this Curl Lake camp to isolate when they return home. We know that Alberta Health Services has also directed workers to isolate if they are experiencing symptoms or if they've had direct contact with confirmed COVID-19 cases. So this is, of course, a major concern. This is the kind of event that infectious disease specialists say has the potential to be a super spread event because we have so many workers that are working in quite close proximity. They're flying in and out, being on the buses, on the airplane. That's quite close proximity. And of course, we know that they are all returning to different parts of the country. A lot of people coming in from as far away as Newfoundland. So this is obviously something that public health officials are watching very carefully. We also know that we can't easily shut these camps down. Oil sands and oil energy production is considered an essential service. And we also know that to shut these projects down safely would actually require more people to come to site than they're operating currently. So it is a very tricky situation.
Heather, there's also an outbreak linked to a meat processing plant in High River. What's happening there?
Yeah, so High River is a community that is just south of Calgary, and they are seeing quite a high number of cases. More than 300 cases in High River and Calgary have all been traced back to this Cargill meat packing plant. Health officials say that they're tracing not only to the plant itself, to the workers, but also a lot of these workers live in homes with quite a few people living in the same home, and so spread is happening within that home. We know that Cargill has taken measures to try and control the spread. They've cut an entire shift. But health officials in this province, they've assigned people specifically on this case to help with contact tracing and isolation, because this is another workplace event that has the potential to spread very rapidly, and health officials really want to get on top of this before any more people get sick. High River is, of course, a small community, so there's a lot of people people on edge there, given that there's so many cases in quite a small community, with a lot of them being traced back to this meatpacking plant.
There are obviously questions about food safety. What are health inspectors saying about that? What's the company saying about that?
Yeah, so we know that and health officials have been saying that this isn't something that is a foodborne illness. They're trying to assure everyone that there's a lot of cleaning protocols happening. So this isn't something that people should be concerned about, if they're consuming meat. But there are concerns that we might see a bit of an interruption to food supply. And this isn't the only meat packing plant that is experiencing interruptions because of COVID-19. We're seeing this happen kind of across the country, across North America. So there is a potential here that we might, especially as we see canceled shifts like in Cargill, that production will be decreasing. So there is a potential that we might start to see that impact in sort of availability of products in stores. But as far as the food safety, that isn't believed to be a concern right now.
Heather, we've seen concerns right across the country when it comes to long-term care facilities, care homes, with a very high number of cases. That forced the Alberta government to take over one particular care facility north of Edmonton. Tell us about that.
Yeah, so this is a very rural care facility, Dulac, up near, quite a bit further north than Edmonton. And on Thursday, Alberta Health Services announced that it will be taking over management of this care facility. They identified some problems with staffing. There wasn't enough staff. The staff that were working very long hours. This facility has had an outbreak. They have dozens of cases. They have had 5 people, unfortunately, pass away. The operator of the care facility told Global News that they were surprised that AHS had taken these measures, that they did acknowledge that there were some staffing concerns. But AHS says that it wasn't just staffing concerns. There were some problems with making sure that residents were getting adequate care, that making sure that these residents were being properly identified, tested, isolated, so that they have stepped in just to make sure that that they can hopefully get a handle on this outbreak. We've seen that this play out, time and again at long-term care centers right across the country. We know how devastating this can be on residents if the virus is able to kind of take hold and spread within these residents. I mean, the majority of deaths reported right across the country are linked to outbreaks within long-term care facilities. So this is, of course, a very serious situation. Public health officials, including Alberta Health Services, have been trying to work with, operators of these care facilities to make sure that they have all of the support that they need, the PPE, that they're following directions. But in this case, AHS says that they were not confident that the operators were able to provide the care and all of the safety precautions necessary for their residents and staff. So they have stepped in and taken over in that situation there.
All right, Heather, a lot of information there to absorb, but thank you, and we'll get back to you. Let's go now to Jeff Semple in Toronto. Jeff, the Prime Minister is going to be asked about whether the House of Commons should get back to business. Yesterday, he said it would be a mistake, but the opposition parties want accountability. So there have been some behind-the-scenes negotiations factoring in social distancing and getting MPs from across the country to Ottawa. Tell us about that.
Yeah, that's right, Robin. And of course, we know that Parliament adjourned in mid-March. Since then, there have only been a couple of sittings to pass emergency legislation, and Parliament was scheduled to resume in the House of Commons with a sitting tomorrow. But of course, the prospect of 338 MPs from across the country arriving and gathering in one location in Ottawa, not a good idea, and certainly not a good look for government officials who have been asking ordinary Canadians to avoid going to work unless absolutely necessary, unless they're part of an essential service. So for the past few days, the various political parties have been arguing over exactly what this resumption should look like. Prime Minister Trudeau, his Liberal minority government, had proposed one sitting per week, a very small number, perhaps with some members joining in virtually via video link. Conservative leader Andrew Scheer, though, not happy with that. He wants to see as many as 4 sittings per week. Now, they are starting to get closer in the negotiations in terms of agreeing from a number, it would appear. The Trudeau Liberals now proposing a couple of sittings. Scheer still wants 3 sittings. So we're hoping to get some clarity now at this last 11th hour, the last moment here before they're supposed to resume tomorrow. The Prime Minister has proposed bumping that for 1 more week, and still trying to sort of debate exactly how many people should be in the House at one time. Andrew Scheer and the Conservatives would like to see, maybe 36 or so MPs from the various parties, but while also, of course, keeping their distance from each other and practicing social distancing. But we've heard from Andrew Scheer, who's really been hammering away on this point, publishing an op-ed today and giving several press conferences over the past several days, pushing the fact that, just because there's a pandemic doesn't mean that the Prime Minister can essentially put democracy on hold and avoid taking questions from elected opposition members. The Prime Minister, of course, has been taking questions on a daily basis from journalists, but not from elected officials now for almost a month. So, Andrew Scheer wanting the House to resume, but exactly what that will look like, Robin, remains an open question at this hour, but we may get some clarity on that from the Prime Minister, and we'll certainly be asking him about that in the next minutes as soon as he appears.
Yes, he'll be speaking in a few minutes. The big question on everyone's minds, every Canadian is asking, when are the restrictions going to be lifted? When are we going to get back to some sense of normal? What are Canada's premiers saying about that? I believe it's been dubbed pandemic exit.
Yeah, pandemic exit, trying to come up with some kind of exit strategy unlike any we've had to negotiate before. Health officials, political officials facing this unprecedented question now, how to turn back on the taps of economic activity without risking opening the floodgates to a second wave of COVID-19. And we are now hearing, as you say, premiers in certain provinces talking about what that might look like, particularly, premiers in New Brunswick and British Columbia who have, already identified the month of May. In New Brunswick, in fact, the premier had suggested that one of their models they were looking at was the 1st of May as a date for when we could start to slowly, gradually see some of these restrictions lifted. And even in a province like the one I'm in Ontario, we've seen, which continues to see new cases in large numbers every day. Even here, John Tory, the mayor of Toronto, met with his officials yesterday to discuss, what that might look like if we started to see restrictions slowly being lifted here. Now, slowly is the key word. There is no certainly official talking seriously about suddenly just undoing all of the restrictions that have been put in place. So the question is exactly how to go about this now. And we have seen some models internationally, some of the hardest hit countries, whether it be Spain, Italy, South Korea, where they are now starting to slowly get back to normal life. One interesting case study coming out of Austria, where they are looking at allowing a certain number of businesses in certain essential sectors to resume activity, a relatively small number. They let them do that for 2 weeks, and if after that 2-week period, which of course is the incubation period for the virus, they're not seeing another spike in cases, then they ever so slowly widen that circle and allow another group of businesses and people to go back to work and resume some semblance of normal life. And so the thinking is that we might see something similar proposed here in Canada. Of course, this is provincial restrictions for the most part, so it's really not up to Justin Trudeau at this point to dictate to the provinces what that should look like, although, we may get some guidance from him, and certainly, we will be asking him about that when he appears in the next few minutes. But, there is serious talk now, Robin, about getting back to normal life, some semblance of it now. I mean, I think nobody expects to see things like concerts and, large stadiums packed with people for a sporting event or international travel to be resumed at the levels that we would consider to be normal. But perhaps some industries, manufacturing, might be looking at getting back to work possibly as early as May. But again, it really depends on the province and the numbers that we see over the next 2 or 3 weeks.
Jeff, you talk about these major events not happening. This week, Dr. Bonnie Henry, she's BC's public health officer, she said that the P&E is not going to be happening. That's probably similar to the CNE in Ontario. She said major concerts aren't going to be happening. Travel to conferences isn't going to be happening. We have a lot of our lives essentially on hold, and that travel was probably going to be delayed as well. Ontario created a committee to talk about bringing the economy back online. It's still early days, but what is the Premier in Ontario saying about that?
Yeah, I mean, Doug Ford has been pretty adamant that they will be taking their cues from health officials in Ontario, and has been, certainly compared to premiers elsewhere, even in Quebec, which continues to see a large number of cases, relatively speaking. Doug Ford sort of trying to tread very carefully here and not talking in any serious way about getting people back to work anytime soon, though we have, again, here in Ontario and in Quebec, and again, these are the two hardest hit provinces at this point, heard talks about even the potential of, talking to school officials about whether they might be able to, what might be possible in that regard, whether you start bringing in, small numbers of people on a rotating basis to try and keep class sizes smaller. We have heard experts say that, it is, of course, younger people who are least affected from this virus. So in a sense, there is an argument to be made that it is younger people with whom we should be looking at developing some element of herd immunity. But of course, those young people then go home and see their parents and grandparents. So, it's a tough question at this point. I think here in Ontario, this province, as I say, has seen a gradual slowing of the number of cases, but is still far ahead, at least when you look compared to other provinces. And it's compared to other premiers, Doug Ford has been taking a much careful line thus far when he talks about getting back to work and getting back to any kind of semblance of normal life here.
Jeff, we're keeping an eye on the Prime Minister's residence. He is set to speak in just moments, but I'm going to ask you one more question about those international examples that you mentioned. Some countries are now discussing how to use the growing numbers of those who've recovered and have some sort of immunity to the virus. What can you tell us about that?
Yeah, it's an interesting question, and we have seen, we are now seeing discussions among political officials in Germany and even in the United States, where, if you look at the number of people who have had COVID-19 and recovered, and in Canada that number stands at about a third. If we have sort of 33,000, 34,000 cases, I believe, have had that many. About a third of those in Canada have now recovered and are believed to have immunity to the virus. We don't know for sure whether you can get COVID-19 twice, but if it's anything like SARS, another similar coronavirus, officials don't think that it's likely that you will at least have some element of immunity to the virus, won't be able to get sick again. And so the question is there a role for those people? And particularly in this conversation, we're thinking about health officials, health workers, those on the front line. Certainly if you can identify healthcare workers who have had COVID-19 and recovered, they could be among those sent to deal with the hardest hit patients and, in the hardest hit areas, because they wouldn't have to worry about getting sick themselves. What we're seeing now is that taken a step further in Germany, for example, where they are looking at testing people, doing those blood tests to see if they have antibodies, to see if they have immunity to the virus because they've been sick and have recovered, and then basically trying to see if they could then assign them a certificate that would identify them as having had the virus, which would potentially open up some doors for them in terms of whether they could go back to work, for example, or resume some semblance of normal life. And of course, this is a big question, Robin, as well, because another storyline that we have seen here is just the unknown number of patients who have become infected with COVID-19 and perhaps not even known it. And of course, we're talking about asymptomatic patients, patients who get sick and don't show any symptoms at all. And, exactly how big of a problem that is remains an open question, but some of the numbers have been, quite remarkable. We've seen from the CDC, the Centers for Disease Control in the United States.
I'm going to interrupt you. We're going to talk about that more with Heather when we get back, but the Prime Minister is now speaking. Let's listen in.
Bonjour tout le monde. Before we get started, I want to touch briefly on the unfolding events in Portapique, Nova Scotia. I know we've all been watching this on the news. My hearts go out to everyone affected in what is a terrible situation. I want to thank the police for their hard work and people for cooperating with authorities. I
want to say a few words about the tragic situation which is unfolding in Portapique in Nova Scotia. And my thoughts go to all the people who have been affected by this event, and I want to thank and congratulate all people who have intervened. I want also to convey my wishes for the Orthodox holiday of Easter.
I want to wish a happy Orthodox Easter to everyone who's celebrating today. Even if it's just over Skype, I hope you can spend this special day with family and friends. Although this pandemic has affected everyone, some people have been hit especially hard. Right now, too many Canadians are facing some really difficult situations. If you live with a disability, I don't have to tell you what this can look like. You might be worried about whether your support worker will be able to keep coming. You might be concerned about getting groceries or about your finances. And if you're caring for someone with a disability, you're probably anxious about getting support too. Your voice matters. Your experience is important. And our government is listening. If this crisis has laid bare the gaps that still exist for far too many Canadians, it has also given us an opportunity to address them. It has encouraged us to have even more meaningful conversations about how we can make our country a more inclusive and a more equitable place. Last week, Minister Qualtrough launched a COVID-19 Disability Advisory Group as part of our plan to keep all Canadians healthy, informed, and safe. We're addressing key issues like equal access to health care and information, as well as support on jobs and income. And we're doing all of this work with you at the table. On that note, I want to recognize the outstanding organizations right across the country, like the Rick Hansen Foundation, that are bringing these issues to the fore. You are doing incredible work, and we are proud to be your partner. Last week,
our Minister Qualtrough has set up the consultative group on COVID-19 regarding people who have a handicap and a disability. So we are confronted with an unprecedented situation, and we want to have more equitable access to healthcare and information. We are also supporting financially people who need it, and we have also made provision for the purpose of protecting jobs. This work we carry it out together, and I want to pay tribute to all the leaders and all organizations who call our attention on those particular problems which affect people who are most vulnerable. We're here to be your full partners.
We've developed a 3-point economic plan to help Canadians get through this tough time. We introduced the Canada Emergency Response Benefit to help people who've lost their wages. We brought in new loans for businesses, and we introduced the wage subsidy. But there is still work to do. There are still people to reach. That's why this past week we expanded the Canada Emergency Response Benefit to include workers making up to $1,000 a month, seasonal workers, and those whose EI has recently run out. It's why we put in place new measures to support people in the energy industry, which is suffering right now. And we also brought in support for people who continue to do incredible work in the arts, culture, and sports communities. And it's why we've kept making progress with the provinces and territories on increasing wages for essential workers who need it. Now, things are tough for employers, too. So we brought in a whole range of additional support on loans and credit, and for Indigenous businesses and businesses in the North. And for communities that need extra support, we approved requests to have the Canadian Armed Forces assist in Quebec long-term care facilities, as well as in Nunavik and in Basse-Côte-Nord. Today, I can announce that we've also approved the extension of a request from the Government of Quebec for the Canadian Rangers to help Nutashquan and Equanichit First Nations near Basse-Côte-Nord. All these measures we've brought in are about helping you do the things that will get us through this. And it's working. We're seeing the numbers trend in the right direction. So we need to keep doing what we're doing and keep being extremely careful. And we will get through this together. Depuis le début de la crise,
since the outset of the crisis, we have announced historic provisions, the emergency assistance, and we help millions of workers, and there are some people whom we must help, additional people whom we must help. This is what we have broaden the scope of the emergency Canadian help, and we continue helping the people who continue in the field of arts, culture, and sports. And we also work with the provinces and territories in order to increase the wages of essential workers who need it. It goes without saying that this is also a difficult period for employers. And this is why we have introduced a whole series of additional measures, including contributions for companies, including indigenous and northern companies, and also for communities which need more help. We have also accepted the request for the deployment of Canadian armed forces in Quebec and Nunavut and Basse-Côte-Nord. And I can also announce that the Canadian Rangers will intervene in favor of 2 more communities in Quebec, Nutashwan and Tikwanisik. So all these provisions were set up for the purpose of enabling you to follow the recommendations of experts and to help us fight the COVID-19, and so the figures are evolving in the right directions. So together we will make it through this crisis. However, even if we emphasize some encouraging trends, we will not delude ourselves. Throughout the country, thousands of families are going through horrible times because of the pandemic. And let me take a minute to convey my condolences of all people who are mourning and grieving, and all Canadians share your sadness, and they're with you during this terrible ordeal. And as a government, we're here we have your backs, and we'll be crossing those difficult times together. And of course, we need to think about these elderly people in those long-term residences who cannot see their children or grandchildren except through FaceTime sometimes, and they're scared. And they hear and they see the news and they see how awful the situation is in home for elderly people, and they're worried and they wonder whether they'll be able to see their children and grandchildren again. This is something that makes them grieve, and we should do everything we can in order to work together, and also emphasizing that we must continue to stay home. We must continue to slow down the spread of this virus, and together we'll make it through this crisis.
Because it's Sunday, I want to end again by talking directly to all the kids who might be watching. This week is National Volunteer Week. That means we say thank you to everyone around us doing things like helping seniors get groceries or putting in a shift at a food bank. You can join in from home, too. Ask your parents if you can help them make dinner and do extra cleaning around the house. Help your brother or sister with schoolwork. Say hi over FaceTime to your grandparents who I know are missing you. Young and young at heart, we can all make a real difference. I heard a great story the other day about a restaurant in Nova Scotia, the Canteen. They've turned the restaurant into a community kitchen where people pitch in and get meals to those in need. And there have been thousands of Canadians who've already signed up through our national COVID-19 volunteer recruitment campaign to lighten the load on our frontline workers. Everyone can help out. Everyone can help us get through this. À tous les enfants qui sont à la maison.
To all children who stay at home, do not forget that you are needed. And ask your parents if you can help them cook dinner or clean the house. Help your sister or your brother with homework, and say hello to your grandparents on FaceTime, to your grandparents who miss you. So we can all contribute to making our country a better place. And so through this crisis, we all have a chance to contribute to improving the situation, and we will all do our share together. Thank you. Thank you, Prime Minister. We'll move to the question period on the phone. Moderator, you have it's for you.
First question, Michelle Carbert from the Globe and Mail. Your line is open. Please go ahead. Good morning, Prime Minister. Thanks for taking our questions. My question is with regards to the government's decision to tighten the scrutiny of foreign takeovers of Canadian firms impacted by the COVID-19 pandemic. Why is this decision important, and why did you take this decision a month after European countries started doing this?
We recognize that countries around the world are looking at their own regimes and recognizing that there are vulnerable businesses that are going to be important to our recovery, who are perhaps exposed to foreign purchases in a vulnerable time, that we need to be careful we're taking care of. So we will be strengthening our oversight and paying close attention to foreign investment in this country to ensure that there isn't people taking advantage of this crisis. We
recognize how important it is in this economic slowdown, period of economic slowdown, to make sure that people overseas should not decide to take advantage of the situation to buy out or in Canadian companies or investing in them more than they would have if we were not in a situation of vulnerability. This is why we emphasize how important those measures are for the purpose of protecting our industry and our economy.
And as a follow-up, are you aware of any foreign takeover deals that are coming or have occurred since the pandemic? And are there any sectors you're concerned about?
I think we've highlighted that certainly as we look at challenges around supply chains for essential medical supplies and personal protective equipment, as we strengthen our own domestic industry and production, we wouldn't want a foreign investor to be able to take that production that is being made for Canadians in this moment of crisis and send it overseas. We also recognize that there are perhaps some startups with brilliant ideas that are facing a cash crunch right now that we would very much want to remain Canadian for the coming years, who could be exposed to predatory foreign investors. This is something that we're, of course, going to be keeping an eye on.
Thank you. Prochaine question, modérateur.
Thank you, merci. Prochaine question, l'inaudible, la presse canadienne. À vous la parole.
Oui, bonjour, Monsieur Trudeau.
Good morning, Mr. Trudeau. Can you tell us what the status is of negotiations for the resumption of work in the House of Commons, and who will be responsible if we can't do it? Well, we are at the moment concerned about the fact that we've yet to strike an agreement with all parties in order to be able to hold our sessions tomorrow morning. And so tomorrow, on April 20th, we should be able to hold our sittings with 330 MPs and with all the staff surrounding the MPs. So this is not a situation where that should happen. So we need to hold those sessions, and this is why we had very, very good conversations with most parties. So I think we're about to reach an agreement for the purpose of being able to meet each week and be able to ask questions and move forward with our legislation. However, the Conservatives are still doing their best to slow down this reasonable agreement, but we hope that we'll have an agreement soon. In other words, you're telling us that it is the fault of the Conservatives, and you've been speaking to the children today because this is Sunday. So what kind of an example are they giving to the rest of the country if they prevent the country of doing what it has to do? Does that mean that federal politicians are just unable to reach an agreement amongst themselves in the interest of the country? Answer. Yes, of course, I agree with you. We were clearly hearing experts telling us that we have to make responsible choices and curb the traveling in the country. So this is why we should not, in our view, hold traditional sessions. And I believe it is very important to continue to have our democratic institutions at work and to keep democracy going. And I believe that we should be selecting opportunities and give MPs from the opposition the opportunity to ask questions. Therefore, we are making proposals which are reasonable and seen as reasonable by all other parties, but ask the Conservatives what their approach is and why they are trying to obstruct and why they're unreasonable in this business.
We're in a situation right now where our public health authorities, our experts, and common sense tells us we need to continue to limit our movements, we need to continue to work from home, we need to continue to do everything we can to ensure that people are kept safe from further spread of this pandemic. That's why it would be irresponsible for the House of Commons to resume tomorrow as scheduled on April 20th. With 338 MPs, their staff, support staff in the House of Commons, security, people coming in from across the country at this particular point. We have proposed, and it's been accepted by, largely accepted by the other opposition parties, that we should have accountability measures. We should have Parliament that functions, but we have to do it responsibly. And that's why coming back every week for questions and for work on passing new legislation is something that I think is reasonable and is acceptable to most parties. I believe deeply in our democracy, in our democratic institutions and our principles, and it's important to be accountable. I'm perfectly happy to be taking questions every day from media, and I'm looking forward to taking questions from opposition parties. But it has to be done in a responsible way, and right now the Conservatives are not taking a responsible approach.
Thank you, merci. Modérateur, prochaine question.
Merci, thank you. Next question, Libertium, Canadian Press. Please go ahead.
Yes, Prime Minister, thanks for talking to us. The NDP is asking for, in terms of parliamentary sittings, 1 in-person day and 2 virtual sittings. You have proposed only 1 virtual sitting. Can you explain why 2 is unacceptable?
I think it is important that we have in-person sittings, and I think 1 a week seems about the right number in a reduced fashion. But we also have been clear from the very beginning that we think there should be virtual sittings to allow parliamentarians from across the country who aren't within driving distance of Ottawa to continue to participate. And that's why we have been pushing for virtual sittings. We have heard from the House of Commons administration that they are incapable of standing up virtual sittings for this coming week, but we are very open to increasing them over the subsequent weeks because it's important that we be able to hear from all parliamentarians.
Follow-up?
And as a follow-up, there's a report of a deal that has been reached. Can you confirm that a deal has been reached with the opposition parties?
I can't confirm anything like that. As I came out this morning, I heard that we were very close on it, but I haven't in the past half hour got notice that there is a deal. I think it seems very, very reasonable that we can agree that there needs to be a parliament that is functioning responsibly in this difficult time. Most parties have responsible proposals forward, and I certainly hope that the Conservatives will agree to doing the responsible thing here.
Merci. Modérateur, dernière question au téléphone.
Last question on the phone.
La prochaine question, Raymond Filion, TVA. À vous la parole.
Oui, bon dimanche, Monsieur le Premier ministre.
Good Sunday, Mr. Prime Minister. Can you explain to us what those virtual sessions would look like? Well, the House is at the moment examining a number of proposals. So the idea would be to enable MPs across the countries to ask questions and make speeches through video conferencing with the same entitlement to take the floor and length of speech as would be the case if there were traditional sessions. However, regarding we've yet to finalize technological arrangements for the purpose of being able to do it. In your speech, you have emphasized that thousands of families are going through very, very difficult times, and Premier Legault said that his government has been ill-prepared to confront the crisis, and there will be time for a post-mortem period or examining an after-the-fact examination of what happened. Was your government prepared for the crisis? Well, I believe that when we go through a tragedy just like the one that we are going through, nobody can say that we were perfectly prepared, and we hope that this will not repeat itself. But if that should be the case, I hope that we'll be better prepared. And I do know that Canadians at the various levels of government and everybody, they certainly did all their best together for the purpose of protecting people with all the means we had at our disposal. And I believe that we fared rather well relative to other countries. So this is a tragedy, and this is such a horrible tragedy that we're all going through, but a horrible tragedy for many families. So we must do our best for the purpose of exiting this tragedy without more tragedies. Radio Canada. Can you elaborate on the manner in which you think that 3 sittings of a reduced number of MPs is not reasonable? Well, if we want to look at things the way they are, we have to acknowledge that many people cannot come and attend sessions of the House because they live too far. So this is why we recognize how important it was to hold virtual sessions for the purpose of bringing to the House virtually all people who are entitled to contribute to our discussions and debates. And we also want to be in the House for the purpose of answering their questions, although virtually. This is important for democracy. It's a good thing to be able to answer questions from journalists and media in general day after day, but parliamentarians also have the same right to ask questions. So most parties agree that this would be what we're suggesting is a reasonable compromise.
I think it's extremely important that we remember that people are elected to Parliament in every corner of this country to be their community's voice in Parliament. And that's why, particularly in a time of crisis, it is important to look at virtual ways that allow members from every corner of the country to engage in parliamentary debate and discussion, and not just those who have the opportunity or the proximity to be around the National Capital Region. That's why we've been pushing the virtual sittings. We know that accountability is important, and taking questions every day from the media is a good thing, but it is also important that parliamentarians and opposition politicians get to ask questions of the government, which is why we've proposed that the Parliament sit every week in a reduced fashion, and that is a proposal that was accepted by most parties. The Conservatives still need to work on it a little bit in terms of their own reflection.
Est-ce que vous seriez ouvert quand les outils virtuels seront disponibles?
Once the virtual tools are ready, would you be open to holding several virtual sessions per week? Because so far, given the nature of your proposal, opposition parties could not, for several days a week, ask questions. They cannot do it every day. Would you be willing to hold several virtual sessions a week? I can assure you that we do take into account the comments and the requests which are made by the opposition parties. Media do know it, and so we are selecting the best possible options, and we're trying to do what is necessary to meet the real requirements throughout the country. We're always open to work at Parliament, but we have to do it in a reasonable, cautious manner. And this is what we're attempting to do, and must again repeat that most parties agreed. Only the Conservatives might perhaps derail the process and force us to meet again tomorrow and not have 338 members.
Parliament, that you believe in accountability. So why is your party still haggling at the last minute over terms of this sitting? Why is this so complicated?
We have been consistent from the very beginning, from a number of days ago, where I said we have a proposal to bring back Parliament every single week and ensure that we're expanding and looking at virtual sittings as quickly as we can. This has been our position, and we're consistently on that position. Most opposition parties found this to be reasonable. There is one party, and because the House is scheduled to resume tomorrow morning, there is required to be unanimous consent by the parties to not come back tomorrow morning, and the Conservatives are not wanting to be reasonable in this, I think.
Australia and other countries are calling for an international and an independent investigation into the origins of the COVID-19 outbreak in China. You've said this is not the time to point fingers or assign blame, but are you supportive of this investigation in the future? And do you still believe China responded and reported adequately?
I think it's extremely important that we understand exactly what happened and ask really tough questions of all countries involved, including China. This is something that we need to pursue. But my priority right now, and the priority for countries around the world, needs to be doing everything we can to keep our people safe and make sure that we have the resources necessary to protect our citizens and get through this, and that will always be my focus.
We recognize that there are important questions that need to be asked. We need to see what happened and how, and what responsibility countries have in this, and that includes China. But the priority for myself and other leaders has to remain what we do to keep our citizens safe.
Ian Wood, CTV News. Prime Minister, a correctional facility near Montreal has confirmed dozens of COVID-19 cases, and the same is true with other facilities across the country, including one near Vancouver. What are you doing to protect the incarcerated population and the corrections staff in these facilities to stop the spread of COVID-19?
From the beginning, Corrections Canada has taken measures to protect both inmates and staff in these facilities, including eliminating visits, reducing transfers, looking at measures including staggered timetables to keep inmates and staff more separate from each other, ensuring that there are different mechanisms in place, and those reflections are ongoing. We're always looking for new ways to ensure protection of Canadians in those facilities.
And some provinces have had to cut elective procedures in hospitals to prepare and manage COVID-19 patients or prepare for them. Canada already has long wait lists for some procedures. Is the federal government going to assist provinces to make sure that these existing backlogs aren't amplified once we're through this?
We have a tremendous amount of confidence that provinces are going to be able to continue to manage their healthcare systems appropriately. We sent them $500 million in new resources to ensure that they are able to continue to deal with this crisis. One of the key elements through this crisis was ensuring that if more and more people got infected, there would still be emergency beds for them. There would still be intensive care units available to them to deal with the very real challenges of COVID-19 and prevent the death rates from skyrocketing as they have in other countries where their medical systems were overwhelmed. I think Canadians understand how important it is to make it through this crisis as quickly as possible so we can get back to normal. But getting through it as quickly as possible means being very careful about what we are doing right now to maximize our opportunity to help as many Canadians if they get infected.
Prime Minister Janet Silver, Global News. In Austria, for example, they have a plan to get businesses reopened, and they're doing it in a 2-week process. They open a business, a small business, monitor for 2 weeks. If the cases don't go up, they continue then with hotels, restaurants, etc. Provinces here in Canada, there are some that are have plans that they're announcing on how they're going to do that. I'm wondering what the coordination is between your government and the provinces. Will the federal government put a plan up as well? And what are you saying in terms of which businesses should be able to reopen first and when?
Many of the decisions around what makes sense in terms of a careful restarting of the economy are much more appropriately made at the provincial level. given both provincial authorities and the reality that the shape of this pandemic is very, very different in different parts of the country. What we are working on coordinating with the provinces is a set of principles and approaches that can be applied at different moments and in different ways across the country. We want to be there to ensure that there is testing capacity, that we are supporting on contact tracing, that we are remaining consistent in the messages that Canadians are hearing from the different orders of government across the country about how to be very, very careful to not allow for a resurgence of COVID-19 just as restrictions start being eased. These conversations are very much live with the provinces right now. We are listening very carefully to what experts and looking very carefully at what is working and has worked in other jurisdictions and seeing how and if that can be adapted to us. We recognize from the beginning that we have been slightly slower. We were able to hold off the pace of the virus in Canada for a few more weeks than many other places, and therefore we can take advantage of learning what works in different situations to adapt it to Canada. We are being extremely thoughtful about that easing, and again, people need to know it's not going to suddenly reopen in any part of the country overnight to what it was before. We're going to have to be very, very careful, very gradual, very progressive if we are to prevent the kind of resurgence that would send us all back into lockdown as we were before. We want to make sure that what we are doing now is not for nothing, that we manage to get through this with the kind of containment and control approaches that the proper measures will allow for. Okay. Nous savons que les gens veulent savoir quand ça va se passer, qu'on va pouvoir relâcher certaines des restrictions, mais nous devons...
Many people, of course, are wondering when and how we are going to start lifting restrictions, but we have to be very careful, do it gradually, and remain extremely vigilant. We will also be looking at other jurisdictions to see what has worked there and sometimes what challenges they have had to face at different stages. There will be choices to be made in different parts of the country. Those choices may sometimes be different, but as a federal government, we are coordinating the approach so that the principles that underlie the progressive reopening of the economy be consistent across the country.
Alberta oil sands camp has sickened at least 12 people around Alberta and reports of other cases in other parts of the country from that. Should measures be in place to ensure that returning workers isolate whether or not they have symptoms?
I think that's a decision for the government of Alberta, but certainly we all understand how important it is to keep workers in essential businesses, workers who continue to work, as safe as possible. Safety of workers, of their families as well, needs to be the primary consideration of any government, and I certainly expect that to be the case in this one as well.
Merci beaucoup. C'est ce qui met fin à la conférence de presse d'aujourd'hui.
Merci tout le monde.
You just heard from the Prime Minister at his home in Ottawa. Let's bring in Global's Heather Yerkes-West and Jeff Semple, our correspondents in Calgary and Toronto. Jeff, let's start with you. Obviously, the Prime Minister is being grilled about whether Parliament can reopen. We have to remind our public that 338 MPs are right across the country, and they'd have to get on commercial airlines to get to Parliament.
Yeah, that's right, Robin. And he was hammered on that point over and over again in various forms. Here we are now at the 11th hour. Parliament set to resume tomorrow morning, and yet the government has still not been able to agree. And they need a consensus first to postpone Parliament further and then to decide what these sittings might look like. All parties agree that there should be some form of weekly sitting, whether actually in person with a smaller number of MPs or done virtually over video links like Skype or Zoom, for example. But the parties then disagree on exactly how many days, how many sittings, what that should look like. And, Prime Minister at one point directed children directly and addressed them directly for noting that this is National Volunteer Week, and was actually asked, what kind of an example are you setting for children as a government if you can't agree on how to move forward with this? And, observers have noted that a lot of companies are doing this exact thing right now. They figured out how to connect with each other over various video links and holding video conferences where they used to hold meetings. So why can't the government of Canada do the same? Now, Justin Trudeau did note there that it sounded like the parties were very close to an agreement, but as he had walked out of Rideau College, they were still negotiating the finer points of this. So we'll see if an agreement comes out soon. It certainly sounded like we might be about to hear something, but at this point there is no agreement, Robin, and at this point the House of Commons is scheduled to resume tomorrow morning.
Heather, there were a couple of jabs at the Conservative leader, weren't there?
Yeah, obviously the Prime Minister is trying to make his point that they're open to moving forward, and they have to follow public health guidance. But it's worth noting, too, that the Conservative government and the Conservative leader, he published an open letter on Friday, I believe, that they're open to moving forward as well. They just want to see in-person sittings involving maybe a smaller number of MPs on a more frequent basis than once a week. So it will be interesting to see, in the coming hours if an agreement has in fact been reached and what tomorrow will look like in Ottawa.
Heather, he was asked about the workers in the oil sands, the ones who are living in camps. What's the clarity on when they leave the camps? Are they getting on planes to go back to their home provinces and self-isolating? What's happening there?
Yeah, so this is really up to provincial health authorities. You heard that the Prime Minister say that this is sort of up to the province's discretion. And as I mentioned earlier, the different provinces are taking different approaches. Workers that are returning to Saskatchewan and BC have been told as of yesterday that they are to isolate for 14 days. In Alberta, the company is telling their employees via an internal memo that the direction from AHS is that they only need to isolate if they are either showing symptoms or if they've had direct contact with someone that is a confirmed case. So we have some different messaging going out. Of course, we know that there's there's people that are traveling outside of these three provinces as well. So this is a concern and something to be watching very carefully, especially when we're seeing sort of mixed messages to workers depending on where they're from.
Jeff, the Prime Minister was asked if his government was prepared for this pandemic. He said he wasn't perfectly prepared, and then he was asked about when and how they were going to reopen the economy and restart business. What was his response to that question?
Yeah, to be honest, Robin, I actually had a technical issue here when he was asked about that, so I don't know exactly what he said, except for the fact that, that has been a question that has been asked of him now for several days, and I think he's, constantly sort of kicked that can down the road as best he can, talking about many weeks before we can start seeing restrictions lifted, saying they are working with advice from public health officials, but also very wary about the potential for a second wave. And, it's worth noting as well that most of the restrictions that we have seen imposed in the states of emergency have been at the provincial level. So, it's also a question as to how much the federal government could really do in that regard when we talk about lifting restrictions. Certainly one thing the federal government can do is as it pertains to the border closure between Canada and the United States, and we know that that has been extended for at least one more month. As for the others, Robin, we have seen, different noises coming from different provinces. As we discussed earlier, the premiers in BC and New Brunswick, even in Quebec, talking about, serious conversations now underway to look at what steps might be taken in the coming weeks to start lifting some of the restrictions that many of us have been living under now for several weeks.
Yeah, he basically said that it was going to be up to each province to decide this, and it would be gradual, that the economy and business is not going to happen overnight. Questions were directed at him about what's happening internationally, and you talked about that earlier. Places like Austria and Germany, they're opening things on a 2-week process, that kind of thing. And then we also talked about the outbreaks in prisons and what's going to happen there. And a lot to cover today, but thank you for your time, both of you. Let's recap what we heard from Prime Minister Minister Justin Trudeau today. He says he cannot confirm a deal on the return of Parliament. The federal government wants to include virtual options. Today, the Prime Minister said the Conservatives are not taking the responsible approach on how Parliament should return. Trudeau also said there is still work to do to help Canadians affected by the pandemic, and one new measure announced today. He says the Canadian Rangers will be providing more support to rural and northern communities in Quebec. You can find full details on globalnews.ca and tonight on Global National, where we'll have all the top stories on COVID-19. I'm Robin Gill. Thank you for watching. We now return you to regular scheduled programming.
This has been a special report from Global News.